Thank you, Sahani sir. Good evening, good afternoon, and good morning. This is the 1784th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Shelly Sharma Bhosale. Let us begin the session with 1 minute silence. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. The purpose of this forum is to take homeopathy to every home around the world, and we are very happy to say that the international session comprises of doctors from 65 countries, and all are doing excellent services to humanity. And today, let me come to our guest. As you know, that Dr. Shelly Sharma Bhosale is having MD in homeopathy, and she has completed her PhD and has been awarded her PhD degree from the Defense Minister of India, Dr. Sri Rajnath Singh, in 2023. She is having diploma in IACH Greece, and having done advanced course from Greens in psychiatry, and has done fellowship in psychiatry and counseling practices since 2011. She has successfully treated a wide variety of patients from children and to elderly, and she has helped the revised to heal the variety of illness, including incurable and emergency diseases, cancer, psychiatry, and many more. She is running 2 clinics independently in Maharashtra, in India, one in Mumbai and the other in Sangli. And as a researcher, Dr. Shelly Sharma has been publishing and presenting scientific research papers nationally as well as internationally, and has been publishing research articles, scientific research journals nationally and internationally. Was awarded the best case presentation in Liga in 2019, and invited for national radio channels to educate people about the benefit of homeopathy. Ex-associate professor in psychiatry department, involved in as a keynote speaker in many colleges, conducted educative webinars for students and doctors nationally and internationally, conducted many health awareness camps, talks for patients, and running independent YouTube channel, Instagram channel to educate people and doctors and students. And the doctor has presented a lot of excellent sessions in this forum. And today, Dr. Shelly Sharma will be talking about pediatrics and homeopathy with the case presentation. So we proudly welcome the guest of the day, and Dr. Shelly Sharma, to this stage. Welcome, madam.
Thank you, Dr. Danish, and hello, everyone. I'm very happy to be once again sharing my experience with you all, hoping that whatever struggle homeopathy is going through, we stand out as wonderful and most classical homeopaths and help masses with our healing system. I would say homeopathy is not a medicine science. Homeopathy is a healing science, and Hahnemann on and off keeps on telling about it in his Organout. It's a spiritual science. It's a healing science, correct? Because what is the difference between being a healer and just treating it, right? So when you treat a disease, like for example, you get bronchitis, a child, like this. So today our topic is on a child. So I'll focus only on children, right? So what I mean by you're being a healer. So healer is someone who will heal you. What do you mean by being healed? Being healed is, healer is that person when in your life, due to any circumstances, your emotions, your mentals, your psychology has been scarred or has been disturbed. And then because of the disturbance in your psychology, which is at the emotional level or mental level, it is manifested through the vital force on the physical level, then you get a disease. And when I say that we are healers, means we are not targeting the physical aspect of the body. We understand that disease is just a fruit But root is something else. You know, we are not just body. I keep on telling, we are something beyond body. We are emotions, we are intellect, we have a spirit, and there is something which is connecting everything from spirit to body is something we call as vital force. So vital force is something which communicates between your spirit and your body. And when it is going through your spirit to the body, it goes when it is properly aligned. It is when you are healthy according to Hahnemann. But when there is no proper alignation, when there is derangement of the vital force, we call it sick. So whenever you want to treat any disease, remember, the deeper you go to the patient, the deeper you go into the human mind, emotions, the better pathologies you can treat. You know why some homeopaths are able to treat cold, cough only, while some homeopaths are able to treat cancer? Maybe some homeopaths are able to treat or reverse pathological conditions, or sometimes we are able to treat coma conditions, right? 1 second, I'll just share my slide with you all. Yeah. Is it visible? Fine.
Visible, fine.
Yeah. So why some homeopaths, are able to treat your just rheumatoid, just pains? Some homeopaths are able to treat cancer. Why? So the only answer is we have to first understand what we are. We are not just body, as I said. There is something which is body. Okay, we have a body which is pathology, correct? Suppose I'll just tell you, I'll share with you something. Thank you, Dr. Hahnemann. So I'll just give a short recap so you will be better able to understand. For example, we are not just body, correct? We are not here. We are not just a body which is made up of organs, tissues, etc. We are something beyond that. What is that which is beyond? It is your emotions, it is your mind, it is your spirit. And then what aligns everything is known as our vital force. Okay, it is known as vital force. Now, when this vital force is the force which communicates between your emotions, mind, spirit, and the body. See, we don't have x-rays, or we don't have the capacity to see into the emotions where they are deranged. We don't have the capacity to see into the tissue where there is degeneration or where there is cancer formation. So your body is very intelligent. What it does, it throws some signs and symptoms, which is called as disease. And when it throws signs and symptoms, we should go beyond the signs and symptoms. What made this body deranged? Why this patient landed up into cancer, or why child's bronchitis is not getting treated? We have to know the root cause, right? So this is what I'm going to, share with you, how we can go deeper, understanding a child, understanding the patient, and the more deeper you go, the better results you can give in a case. Okay. Now, the core structure of a pediatric case taking is what? Most important is the chief complaint. You cannot bypass the chief complaint. You have to take the chief complaint in detail. You have to take everything. How the disease started, what is the experience of the disease, what are the expressions of the patient, any strong peculiarities you have to make into understanding. Second thing which you should never bypass is the past history. Now see, the child is born, maybe he is 5 years old. Like, I've been treating a lot of autistic cases, mental retarded children, and to my surprise, within 1 month, 2 months, those autistic children have started talking. Now the question arises, how come this autistic child is talking in 1 month, maybe in 2 months, which he was not able to talk for 6 to 7 years? Like, you have something in homeopathy, so it is able to show these results. Now, the reason is, I'll tell you a simple reason. For example, you take the mind. This is the conscious mind, right? This is the subconscious mind. This is the unconscious mind. So when we take a case of a patient, be it a child, be it an autistic child, be it cancer, be it anything, when you focus your case taking only up to the conscious level, no, here you will be able to crack only those kind of cases which are maybe inflammatory cases. Here, by just taking a case, taking till the conscious level of the patient, here you will not be able to decode the autism. Here you will not be able to cure a cancer. You will not be able to reverse an autoimmune condition. You can just manage diseases here. Now, when you take case taking deeper, when you go deeper to the subconscious part, now what is subconscious part? So subconscious part is that part where our feelings, our emotions are just put under the carpet. There is some problem in me. I know that, but I don't know what. Right? Like, for example, I always give an example about magnesium. He needs a lot of love. He needs a lot of respect. He needs a lot of support. He needs a lot of care. But unfortunately, he's into an environment where he's not able to get it. Because he's a child who cannot ask for it, but he needs it. So what the magnesium child will do, he will just put his emotions under the carpet. And he will grow, he'll try to grow as an independent child, but here his emotions are repressed. It goes to the subconscious level. Because as he grows, the magnesium child's ego develops. I'm talking about ego, which Sigmund Freud spoke about. It gives him a capacity to understand, fine, I should not be asking, I should move ahead, I have to be more logical. So he put all his emotions under the carpet. Or maybe a Natrum child, Ignatia child, she needs a lot of love, care, affection, but she is looking, she's into an environment where there is a lot of fights between her parents. Her father and mother are constantly fighting. Now, what does she does, she may forget about it, but under the carpet, what does this girl puts? I cannot trust relationship. Relationships hurt. There is no successful love story. So Natramute gets, the girl as she grows, she gets more reserved. Ignatia, as she grows, she stops believing in love. Maybe she becomes more independent. Maybe she becomes more ambitious, and she will work for ambition, but inside she needs a lot of love, because here she has put all her emotions under the carpet. So when you're taking a case, you're able to decode the subconscious level of a patient. It is here you can treat lot of incurable cases. It is here you will be able to reverse a cancer, reverse a fibroid. Here you can make an autistic child maybe to talk. And when you have a capacity to go to the unconscious level of the patient, here you can do miracle for the patient. If you are able to decode that emotion of the patient, if you can understand his subconscious language. So the better you become with the case taking, the better good you are with observations, the good you are to understand the story of this soul who is going through this journey, the better you will be able to decode the patient. Fine. So how do you do that? One is what the patient is throwing on the body, his chief complaint. You have to know in details. Vital force is talking to you. Get it. Just try to know what is talking, what the vital force is trying to communicate to me. I have to be open to receive all the signals. So just try to know what it is talking at the level of chief complaint. What peculiar symptom, what characteristic symptom this vital force is throwing. Then you go to the past history. Maybe in the past, you try to know how was the development of the child, how was his milestone, how was the pregnancy history of the mother, because mother's psychological state affects the child. Again, family history is very important. And then you have to observe the child, correct? And try to know the mind. Why we need to treat pediatric children classically? The reason is they are the foundation of this universe. And if we treat them right, we are healing a person. We are more like a healers. We are indirectly helping the mankind suffering. We are not just putting the things under the carpet. We are trying to decode. We are trying to cure the disease. Correct? Now, we are most doubtful when we treat pediatrics is about homeopathy is very slow. I'm very sure homeopathy is never slow. When you're tackling acute, homeopathy is very fast. I would say it is faster than antibiotics. You just need to pick up the right symptom of the child. You just have to give the right remedy. Sky's the limit for you. Trust. Because Kent said beautifully in his philosophy that, what he want to say is, homeopathy is a universal science. It is having unlimited capacity to treat, but we are limited. We don't have the capacity to understand the depth of homeopathy at the level of infinity. We are lacking. Homeopathy is never lacking. Okay, so you should not fear to tackle acutes in children. Yes, it could be excellent antibiotics, alternate to antibiotics. And my patients, I treat them, not a single child needs antibiotic. See, I will not say that you have to be very bold and, don't be foolish. If you're good with your homeopathy, if you're good with your knowledge, if you're very sure what remedy you're giving, you have to be very confident. Go ahead. Antibiotics is not the needed thing for any infection until and unless when the cause is from outside. If the child is having a dental extraction, you should give an antibiotic. If it has a fall, it has an accident, it has a surgery, you need to give antibiotics, because Hahnemann says in his organon, when the cause is from outside, you need to take help of modern medicine. But 98% you can take care. You should never fear fever and never ever give specifics to your patients. Okay, always remember, I keep on telling in my lectures, in my series, that we are not treating the disease, we are treating the process which is happening behind the disease. We are trying to restore the health. We are trying to treat the process so that the tendency of the disease breaks and his level of health increases, right? So I will share a case. This is a case of, I'm not sure if I've shown this case here. This is a case of inflammation of a knee of a 3.5 years old girl. She was just 3.5 years old girl. So she came with sudden pain and swelling of the left knee since 10 days. Her knee was swelled, it was very big. And she was not able to stand, she was not able to walk, she was not able to do any of her activities, she was not able to go to school. Suddenly, she had loss of appetite. There was constant pains. Physical generals, I did not get any specific. So you got the chief complaint, fine? So doctors had advised that you have to start steroids for her because her RA was positive, CRP was high. Okay, her CRP was high. I think RA was negative, but CRP was high. Means there is something autoimmune conditioning starting in the patient, correct? So patient came with sudden knee pain. Now you have to know how it started. So you have to know how it started in two aspects, physical and emotional. So when you know both the journeys, you will be better positioned to treat her. So the patient said, Doctor, 3 days back, she suddenly developed skin rashes. So we gave her anti-allergic medication. It settled down in 1 day. The next day, she got inflammation of her eyes. There was a lot of redness. And then we gave her medicine. Anti-inflammatory medicine was given, eye drops were given. She was better. And suddenly, the patient developed diarrhea. And we gave medicines for the diarrhea, and then her diarrhea stopped, and then suddenly the morning she woke up, her knee was swelled and very stiff and very painful. Okay, now we got the journey of the disease. So I said, like, what happened 2 days before the skin eruption? Now see, this girl was healthy, fine. Something must have happened now. Why she developed the skin rashes? Something must have happened. So you have to find out what happened. So they said, like, yes, 2 days back, this girl had fight with her elder sister. Okay, this girl is 3.5, 4 years old. Her elder sister is 6, 7, 8 years old girl. Correct? So she said this younger daughter, this patient had fight with her elder sister. And she abused her elder sister. Her mother and father both expressed disapproval. They reprimanded her and they said, this is wrong. You should not be abusive. They got angry with her. And after that, what happened? She started her skin complaint. So they said, Doctor, I don't know this. My daughter, she is not usually an abusive child, but whenever she is angry, she becomes very abusive. In her family, no one is abusive, but we don't know from where she has learned this language. Now remember one more thing. We always think, our environment influences us. Like, if you're in an abusive environment, you will start abusing. No. If you have the tendency, or if you have the karma to be abusive, you will automatically get interested in abusive language and you will start using it. But if she would have been aurum child, though she is in abusive environment, she will never use abusive word. So it is not outside, it is inside, which chooses what to do and what not to do. About that girl, she likes to dress up well, she likes to look good. She wants her family, sister, everyone to follow her instructions. She's like a boss, in the house, Dadi Amma. She's like a grandma in the house. She's otherwise very helpful, very kind, very lovable child, but she's very possessive towards her loved ones. Okay, she easily gets angry on little things. She's always worried if it's a sister, mother, father, they don't come home on time. Very caring. If someone is sick, she will take care of everyone. So this was the girl. This was the inflammation of her knee. Correct? You can see how swelled it was. And look at this girl, how pretty she is, how well dressed. She always wants everything matching. Her ESR was 32. Her CRP became 21. It means there is some autoimmune condition initiated in her. Fine. So the totality which I took was, because she was shouted, ailments from mortification, ailments from reproach. Very important symptom was, she's a very abusive girl. We have to take it. Okay. Again, she's such a little girl. Her father is late, mother is late, sister is late. She's worried, like, Mama, why she didn't come? Why my sister is still late from the school? So we have to take anxiety about family. She's having a lot of care about her family. She's very dominating. And all her complaints started after suppression of her acutes. So we have to take the rubric causation, suppression of the acute. So we got two causation: ailments from being reproached, ailments from mortification at emotional level, at physical level, ailments from suppression of the complaint. And the pathology went into the left knee. Fine. So this was the repertory chart. And I thought she's a platina child, but she was not platina. I gave the remedy Dulcamera 200 stat, followed by Saclan. And after 1 week, her knee was set back into normal shape. Fine, this was the patient. I will not play the video. We'll go ahead. This was the girl. How pretty, how cute she is. Just look at her. So what is Dulcamera child? Dulcamera child usually is a very talkative, and she will always talk with the air of command. Otherwise, she's a very friendly child, but she's a very obstinate child. These children, these girls who come to your clinic, you will see the parents will say, Doctor, my child is very dominating. She will dominate everyone, from father to mother to her sister, everyone. Lycopodium is also very dominating, but he will be dominating only towards who are inferior. He may dominate mother, but Lycopodium will not dominate the father. But Dulcamera is Dadi Amma. It's like grandmother. She will dominate everyone. They want everything according to their taste. Highly obstinate, but very friendly. They have a lot of anger. They will show anger tantrums, but at the same time, the child will say, mother will say, she's a very affectionate child. She's having a lot of care for everyone. So mother will say, Doctor, don't know why, but my child is very angry, but she's very lovable. Think of Dulcamera. Think of chocolate in these conditions. Activity and desires change. Possessive and full of cares. Admonition, aggravation, very abusive child, very angry if things don't go according to her wish. They will weep and cry together, and change of weather aggravates her complaint. Overactive children then. Okay? Now we all know these particulars, like diarrhea when standing on wet floor, diarrhea after getting wet in rain, asthma alternate with eczema, very important symptom. Cough alternate with eruptions. This patient will have history of suppression of skin complaints. They will have history of suppression of acutes. They will have a tendency towards falling sick at change of weather because they can't take change at mental level. Wet aggravation. Better by warmth. Better in dry weather. Fine. So this was in short about dull camera. I can speak a lot about it, but we have very limited time. I have to teach you some more remedies. So, according to Hahnemann, this has to be a case stick. You have to individualize every remedy to the core. If the patient came with swelling of the knee, I would have just taken into consideration his swelling, stiffness, aggravation by motion, better by rest. I would have given bryonia. But after bryonia, her CRP would have not come back to normal. Bryonia would have worked only like a painkiller, but not to reverse the disease process. You have to go deeper in the case. You have to know what happened, why happened, how is she, how is the child's basic nature, whether the child is caring, angry, aggressive, does the child want affection, what does the child want, what is the need of the child. You have to see that. The formative age of the child is very important. From the time the child is in the womb till 12 years of age are the most important years of the child's life, because here the child's emotions are developing. The child will not understand logic till the age of 12. Child can only understand love language. So we say till the age of 6, it's very important for the child to be near mother. Why? Because mother is what? Mother is a feminine energy. Feminine energy means what? It's about nurturing, it's about care, it's about affection, right? So the child till the age of 12, he needs a lot of feminine care, feminine affection, a lot of nurture so that he can develop trust towards love, care, affection all his life. He needs unconditional love. And after, when the child, after 12th, the child goes into teenager, he needs to be more disciplined. It is here masculine energy comes into play. So that this after 12, the father's role increases in a child's life. And mother should take a back seat here. Because now the child needs to be disciplined. Actually, it is after 5 years the child needs to be disciplined, but it increases drastically after 12. The fathers should discipline the child. They should be strict with the children. They should show them direction. They should learn how to survive in this world, because world after 1920 when they face is actually very harsh, very disappointing. And if you don't prepare your child to face this harsh world full of disappointments, full of disagreements, full of, all chaos, your child will not be able to survive and may go into a mental disease. Fine? Fine. So very important, freedom from prejudice. There has to be sound senses, a lot of attention when you're observing every case, and you should trace the picture properly. Don't be prejudiced when you're sitting in front of your patient, like the child comes, no, I think I will give a briny, and don't take the case thinking as a briny. You should have all your senses open. You should smell the child. If it is a rheum child, or sanicular child, there will be sour smelling. Should touch the child. If the child is very soft, it could be a calcarea, it could be carcinosin. If you touch the child and child feels ticklish, gudguli karke bahut hasta hai, he starts laughing. Think of remedy kalika, think of calcarea silicata, think of silica. They are very ticklish. The moment you touch them, they start laughing. And many prescriptions I've made on that basis. When I examine the child's abdomen, he starts laughing. It starts giggling. Even small children, maybe infants or 1-year-old child, they start laughing like anything. Simple. I got an entry to the rubric. Ticklishness. You can't you will not miss the remedy then, right? Your ears should be very, sound. You should understand the pitch of the child's noise, the cough child is making. How is the cough? When you auscultate, you should be very sure how is this, auscultation, whether you experience, saw like, this rubbing in the chest, keep spongy or toaster. When you feel bubbling, when you listen bubbling sound, when you're auscultating, it's ipecac. Fine. So I've said always, like when the child is in the mother's womb and till the age of 7, the child's brain is in a theta brain frequency. Here, at this frequency, when your brain is vibrating, it's like a state of hypnosis. The child is just absorbing things like a sponge. He is absorbing things through his emotions. And whatever experience a child gets in the intrauterine life till the age of 7 gives a permanent pattern in the life. So whenever you take case of even of an adult, especially if you take case of any psychiatric condition, go to the past history, go to his childhood. You'll get lot of information and direction towards your remedy. Fine? You should check for unresolved traumas, imprints deeply, and you will find a connection. Because mind is the biggest force in us. Mind talks through body. And a negative mind will draw all the energy, and this is where we fall sick. Now, children express more through energy, through body, through behavior than words. So if you want to take a good pediatric case taking, observe the aura of the child, feel the aura of the child, see the energy of the child. Look at the smile. If the child is giving you a very friendly smile, maybe the child is bromium. It's a very cute and beautiful smile. Maybe child is a chocolate remedy. It's frowning and looking at you with suspiciousness. Maybe it's lycopodium. Very irritable child, cranky. Maybe he's chamomilla child. Very decent, well-dressed, no stupidity, aurum child. The choices what child makes is his individuality. Early intervention with proper homeopathy will help the child lifelong and keep him away from many pathologies. You should promote homeopathy since childhood. Let homeopathy be a lifestyle. Okay? Children's psyche is more sensitive and more programmable. You can unturn a lot of traumas, patterns in the child, and make him a very healthy child for the future. And here you have to learn to decode the non-verbal script of the child. Fine? Not go to the Erickson model now. So I've spoken this. Let us talk about lac caninum child. How do you understand whether the child in your clinic is lac caninum or not? So what is a lac can remedy? Lac can is a remedy which is made from dog's milk. It's a matridonal remedies. Now, as this belongs to lac group, milk group. What is milk? Milk is a symbol of nurture, care, warmth. When the child gets mother's milk, the child feels cared because someone is caring him without asking him. The child feels nurtured, he's growing. The child feels warmth and he feels very good. Fine? So here, when you see a lac caninum child, basically, the mother will say, doctor, my child is very good. He will never go against my will. If I say to sit, he will sit. If I ask him to stand, he will stand. He's very obedient child, very responsible child. He will drink the milk. I've instructed him once, beta, after you drink the milk, keep the glass in the basin. He will always keep it in the basin. When he will play with the toys, like a good boy, take the toys and put it in the bucket. They're so dutiful. They're so responsible children. these children have a lot of fear of infection. They have a lot of fear of dark, fear of thunderstorm. What you feel, about this child is these child need lot of love and affection. They just need their mother. That's it. They just need their mother. They want the mother to love them, care them, give them lot of affection, want lot of physical touch, cuddling, etc. And for that love, they will do anything. They're very loyal towards their mother. Not father, especially mother. Now, the mother will say, doctor, uh, my child, like if there is anyone coming in the house, he gets disturbed. I mean, he's just seeking my attention. Many mothers say, he's just seeking my attention. He will come around me. He will pull my dress. He'll pull my dupatta. He will throw something inside. He just wants my attention. If there is anyone here, he cannot bear that I'm sharing my love with anyone. He wants all the love. Now, these children are not much confident outside the house. When they go to school, they will not be the children who will be going on stage and perform. Very family-oriented children are like Kahneman children. Now, when the pathology begins, when does this child start falling sick? One more thing. Lack Kahneman child are weeping. Huh? They weep a lot. Mother said, my child, he will weep at the drop of the hat. Now, when the pathology begins, when they miss the warmth and security of the home. We have a rubric, where the rubric is about lack of warmth and security of the home. How? Maybe mother is working, father is working, they are busy with their deadlines, and the child wants a lot of care and affection. He's not getting it. Maybe parents are fighting. There is a lot of abuse in the house. There are a lot of discords in the house. This is where the whole attention shifts from the child to the couple fighting, and here he may fall sick. And when they don't get affection, care, maybe they become even more underconfident children. Fine. Then what they will do, they will try to gain much more attention of the parent. They will become more underconfident. Gradually, they will develop a guilt. They will feel, I'm not good enough, so my mother is not loving me. I'm not good enough, so my father is not taking my care. They start feeling that. These children, when they start crying, no one can pacify them if it is a small child. Their speech is mostly nasal, like Barata muraticum, very cross and irritable. Okay, when the girls are growing, their breasts are getting affected. Painful mammae in girls, especially during menses, and they are very confused child. So whenever you see that your patient is somewhere between pulsatilla and phosphorus, you feel it's a phosphorus, but there are some symptoms of pulsatilla. If you feel it's a pulsatilla, there are some symptoms of phosphorus, think of remedy lac canine. And especially when there is a history of abuse in the house, there is history of fights in the house, and the child says, I have not got the love and affection. He craves affection and company, mistakes in writing, and cannot complete what he's writing. So this is how his pathology will begin. Okay. So when he comes to you, the child will present as lack of confidence, very self-critical child. There's a lot of confusion and conflict. Okay, and this child will be like natramute child. He will have a motherly instinct towards his siblings. See, some children are very responsible, like aurum metallicum, cocculus. They will care a lot. You have pulsatilla, you have natrium muraticum, extreme caring for the younger siblings. Cocculus will care the younger siblings like a nurse. She will be nursing. Fine, but lack remedy will be caring the younger sibling like a mother. She will say, I have a motherly feeling from a child. This is the feeling of lack child towards the younger siblings. And when she's not getting the kind of affection and attention, she always feels there's something wrong with me. And then, as I said, she will break her confidence, but she will not express to anyone. She will keep things to herself. She will keep on blaming herself. And this is how the pathology begins. They will present generally as alternating sides of complaint, wandering pain, extreme desire for salt and pepper, desire for warmth. There is some relation with the milk. Either they desire or they disagree. Ailments from weaning or no milk. And the skin is very shining and very beautiful. Okay? So this was in short about lac caninum child. So we'll talk some more remedies. So, these are the 5 critical needs of every child. You see, respect, importance, the child needs to be included, accepted, and secured. And whenever child ka pathology begins, you have to see what was lacking. Like for sulfur, for hemimellus, for aurum, for natrum sulf, it is the respect which they are not getting. Calcarea sulf wants lot of importance. Lachesis wants lot of importance. Lac ovinum, pulsatilla, phosphorus, they need to be included. Magnesium, chocolate needs to be accepted. Calcareas, magnesium needs lot of security. Fine? So you have to see, how the child is. Is the child very bold, very timid? So when the child will come to your consultation, he will talk very boldly. Like he will talk, yes, doctor, I'm fine. How are you, doctor? Yes, doctor, I'm studying this, I'm doing that. He will talk very boldly. So you can't give pulsatilla to a bold child, correct? If the child is very timid, you cannot give sulfur to a timid child. So you have to see how the child is presenting to you. Is he being very courageous, bold, and bindas like myrrh, like causticum, like lachesis, like sulfur, or very timid and shy like lycopodium, barata carp, calcarea carp, pulsatilla, etc.? Is the child lovable? Like lac caninum, very lovable child. Phosphorus, very lovable. Magnesium phos, very lovable child. Calcarea phos, very lovable. Chocolate, very lovable. Bromium, very lovable child. Whether the child is responsible or not, you will understand. How? Are they taking care of his belongings? Are they doing their homework properly? Are they taking care of the siblings? Are they following instruction by their parents? You will understand. How is the child? Whether the child is expressing emotions or not. So natrum child will express emotions only with the mother or a father. Extrovert will share information with everyone. They will even tell private things to the neighbors when they come to the house. This is extrovert child. Whether the child is dominating, like Nux vomica, Ignatia, dull camera, Stramonium, they are very dominating, Conium, very bossy children. Mild, yielding, how's the child? You have to try to know this. Okay? So magnesium child needs a lot of love, security, affection, recognition, acceptance. They will never demand everything. But when they don't get it, they will repress all the emotions. It will go inside, under the carpet, in the subconscious mind, and they will develop as a very anxious and nervous child, adult later on. These children don't like aggression because in the childhood, they have seen a lot of aggression and they're very sensitive and soft because magnesium metal is very soft metal, right? Very sacrificing children they are. They will sacrifice everything for this. In the distance, they seem shy or not interested. They could be very weak in study. Actually, all their portions go into repression. They feel not loved by the parents or friends. They can't take disharmony. Not at all. We have Tucrum child. How's Tucrum child? When you see a Tucrum child, you will see that these children are very sensitive, highly sensitive children. Slightest cold will give back his complaints. Okay? Ingrowing of nails. Whenever there is fever, the loquacity, the children become highly loquacious. Like rustox, pyrogenum, lachesis, sporophyllum. They will talk a lot during fever. Otherwise, they will not talk much. Very sensitive to bad news, so much like Calcarea carp and Spongia tosta. Something between Calcarea and Spongia tosta. Very perspiration. They'll desire a lot of exercise. So this is how Calcarea is ruled out because Calcarea don't like exercise. They're highly active children. All the complaints aggravate in full moon. Now we have another child, which is torula. When you see remedy similar to thuja with obstinate constipation, most obstinate constipation in children, with personality of thuja child, with history of multiple immunization, think of the remedy torula. Yeah? Dr. Danish, I think we just have 5 minutes left, correct?
Yes, yes.
Yeah. I'll just cover it in 5 minutes and then
Yes, yes, you can go ahead with.
yeah. So we have sacrum officinalis child. Now what is sacrum? Sacrum is nothing but sugar, right? So these children's, imagine a child who is having a lot of sugar. What happens when we have a lot of sugar? We become fat, we become obese, they become very irritable, angry. This is how sacrum child will present. They'll become very obese child, very fat, very self-centered children, very irritable and cross like China. Sinna, sorry, it's not China, it's Sinna. Very antisocial, biting, refuses food away, and they just want to eat sugar, only sweet. Sacrum children become hyperactive, very restless children, but they need lot of love and affection, lot of cuddling and hugs and kisses. Okay, so whenever you have a child who is very irritable, very obese, having lot of sugar, but want lot of love, care, and affection, wants lot of cuddling. Now see, it is also like caninum who wants a lot of affection and care, but they are not selfish. Sacrum officinalis are very selfish children, very self-centered. The whole family should only revolve around him. They are like bigda hua bacha, spoiled children. That's sacrum officinalis. Fine. They develop bone problems very early in the age. These children have history of being bottle fed. Now these children want a lot of affection and care, and when these children are neglected, it is here the complaints pick up. Ailments from being neglected, ailments from lack of affection. Very moody children, they can't tolerate hunger. There was a child in my patient clinic. Her mother said, like, how the mother will present, the child will be very, lazy, or it could be hyperactive. There are two conditions, either very lazy, very hyperactive. Mostly they are very hyperactive children. The mother will say, doctor, I don't know, but he just want to eat sugar. He cannot live without sugar. Morning, he wants something sweet. He will have chocos. He will have anything sweet. Not ghar ka, but outside sweet. In the afternoon, he wants sweet. Jim Jam biscuit, bon biscuits. He wants a lot of sugar. He wants pastry. He wants cake. He can't live without sugar. And every night, he just want to hug and kiss and sleep with me. He will not allow other siblings to come near me. He just want to do whatever he wants to do. He cannot tolerate anything which is against his passion. So since I got my newborn child, like she had a newborn child, her mother, since then this child is having bronchitis issue. Now, why the child developed bronchitis? It is a way where the body is seeking attention, correct? When a child is sick, he gets attention now. So this sacrum officinalis feels the mother's attention is going towards the newborn child. So his body is programmed and it is becoming sick, so the mother will again give him attention. Fine? They can't tolerate hunger. So this is us. With this, we will stop our today's session. I think we are having just 10 minutes left. Yeah, Dr. Danish?
Yes, yes. You can go ahead to some 3 to 5 minutes.
Maybe I think we will have a question answer session.
Yes, yes, yes.
It will be better. Right?
Yes, yes. Then we can go ahead in that way.
So 10.
Yes, really, the case shown by you are really interesting, and really you show the depth of homeopathy in case taking and how one need to find the case and how the case develop and how a suppression can become a question in front of us, and how in those conditions how we can manage. But in the first case itself, we can show that the eruptions came out just before, just after suppressing the thought. There was a quarrel. There was a quarrel between the children, and in between them they found it very difficult, and thereafter the child developed all these things. So this shows the importance of finding the reason behind the illness. Anyway, it's a time for discussion. Those who want to participate discussion may raise your hand so that we can have a chat, as well as you can write down your questions also. We will allow you to ask the question. I'm inviting Dr. Manoj.
Thank you, Dr. Tanesh. Once again, congratulations, Dr. Shelly Sharma. You showed out the practical application of the classical homeopathy. We know majority of the so-called homeopathy physician often claim themselves as qualified, may be academically, but often criticize it's only a theoretical medicine, not practical. But you proved it. You mentioned about this, the medicine between this pulsatilla and phosphorus. So often it happens very much similar to between two medicines.
Yeah.
That's a very important point that you mentioned about that the lacana is a medicine. Then another one, last we mentioned constipation. The constitution or the patient looks like tuja, but most obstinate constipation torla. So this kind of explanation is needed. This kind of help. As well as we need much refreshing. Always our brain should be activated, and you did succeeded. Anyway, nice presentation. You'll continue your endeavor not only into presentation but also kindly participate regularly in our program, because we are about to complete the 1800 days. The Guinness Record.
I really appreciate the way you're doing. Your team is doing. It's highly appreciated. Highly appreciated.
Yes. And also, I also this requesting you to promote or propel your students to appear this or listen these platforms regularly.
Yeah.
Definitely they will benefit it. But unfortunately, they are not at all interested in listening or studying. I'm very sorry to say that. Anyway, thank you. Congratulations for your classical presentation. Thank you.
Thank you.
And now I invite Dr. Basant Javan Banerjee to say. Yes, sir, you can talk now.
Excellent. It was good presentation. All the detail of the patients. Okay. Thank you.
Okay.
I just want to tell one thing, on this platform. The world needs good homeopaths. The world needs homeopathy. Because modern medicine is useful just 2% in our lives when there is a major issue where vital force is very weak, but 98% we can tackle with proper homeopathy. And the world needs classical homeopathy because, the kind of results, the deeper I'm going with the patients, with the case taking, the kind of pathology is getting reversed. Autistic children are speaking maybe in 2 months. Cerebral palsy children are starting walking. Cancer is being taken care. Everyone should do that kind of work, We should stand together, study proper homeopathy. Homeopathy is very difficult. It's
Exactly.
very, very difficult. It's not
Yes,
an easy pathy.
Definitely, you're 100% right, and it's up to Dr. Ramprasad, sir.
Thank you, Dr. Tanesh and everyone. Namaskar. Congratulations, Dr. Shelly Sharma. Very nice presentation, excellent session, and peculiar session. Case taking in Paediatrics. Peculiar symptom and select the remedy. Practice pediatric case. Very nice presentation and case taking. There are 2 cases. The very important. Select remedy like quinine. So very, very thanks, Dr. Shelly Sharma. There are two types of collect symptom. First, subjective symptom is a very important, and objective symptom. Observe body language, tendency, etc. So subjective symptom is a very important in the homeopathics. Very, very thanks, Dr. Shelly Sharma. Thank you.
Thank you so much.
Now I am inviting Dr. Boblin to say your comments, as well as you can say a vote of thanks at the end after the interaction.
Thank you, Dr. Danesh. I'd like to congratulate Dr. Shelly Sharma, a graduate of ICH Greece under Professor Josh Whitakers, and also for getting her PhD recently in the year 2023. Congratulations, you have done very well. And before I close, I would like to ask you a few questions regarding the levels of health. When the parents find that their children have itchiness on the skin, they will use topical application, especially allopathy, and that will be, as Josh Whitaker says, is an obstacle to cure. So how do you overcome that?
So see, whenever I have my patient, first thing is I educate my patient. I make them understand. See, it's very important for us to educate, because what we are doing, no, we are not doing what is regularly understood by the patient. So once we make our patient understand, see, the child will get an itch after my medicine. Don't suppress. You can just prescribe, if the mother is very curious, you can just prescribe maybe aloe vera gel, coconut oil, or castor oil, olive oil, or lactocalamine. And when you have results, you will see that the parent listens to you, because see, the each child gets after our treatment will subside, because this is the way vital force is trying to throw out the disease or eliminate the disease. Or for example, when you treat a disease, you expect the child to get acute, like a fever. Educate the mother. See, your child will get fever. Just give antipyretic and inform me. So when they inform me, the child meets me, maybe I'll give the Saclac, or if the child needs remedy, I will give it. So once the mother knows that the doctor knows that the child will get an itch or child will get a fever, they are more confident with us. Try and avoid acutes, because they are the only way how you can break through the pathology. Not till then. Acutes are very important in our process of cure of a pathological disease. Yes.
Yes. Yeah, I agree with you. Thank you very much. And I would like to express my gratitude and thank you to Dr. Shelly Sharma for successfully conducting the 1,784 day of uninterrupted webinar by IFPH successfully. It has been a very, very valuable and deep insight into pediatric and homeopathy. And your presentation is very clear and precise. And also your approach in case taking is very good. And once again, I'd like to say thank you to you and hope to hear from you again. Over to you, Dr. Danesh.
Yeah.
Thank you, Dr. Boblin. Thank you, Dr. Shelly Sharma, and those who attend the session in this evening. Hope all of you will join us tomorrow. Tomorrow at the same time, we will have a session from Dr. Venugopal Reddy, and the subject of discussion will be closed loop communication. So he is a behavior scientist from USA. He is practicing allopathic system there, but he is a very important person to us. He always knows all kind of system. He's a person who is always saying and suggesting good things for IFBH also. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.
Okay, thank you.